Welcome back to The Why. I'm Christina Muchler. You go to any major city in the U.S. and statistics show that fentanyl is prevalent there because it's been a major part of our nation's opioid crisis. But I bet you weren't expecting to hear this. A new Washington Post report shows that fentanyl-related overdose deaths went up almost 600% from 2014 to 2016. That's a really short time period. The Washington Post report looked at 24 major urban areas and the surrounding counties. It got OD records from health departments and other departments there, wanting to put a number to the direct link between thousands of overdoses and a rise in fentanyl fatalities across the U.S. They found the trend is much more noticeable in these urban centers. One of the hardest hit was Philadelphia, but just to put this into perspective, here in Chicago, there was a 2,700% increase in fentanyl-related fatal overdoses from 2015 to 2016. That's just 1 year. And the rate of teen overdose deaths just went up 19% in also 1 year. After having declined in recent years, it also doubled from 1999 to 2015. These numbers are from the Centers for Disease Control and Prevention. The CDC says most of the overdose deaths were unintentional, coming primarily from opioids in prescription form and heroin fentanyl form. I talked to Dr. Buck Parker, an emergency and trauma surgeon, and he said there were just so many factors that play into why these numbers are climbing.
You know, it's tough to pinpoint why exactly this number doubled, but I can say that I'm not surprised at all. Over the last, 10 years or so, it's a huge marked difference between the patients that I see that are just coming into the hospital that are already taking some type of a opioid medication, usually prescription. So those patients used to be, they'd take it after surgery for a little bit and, maybe a week or a couple weeks. And now it's transitioned to, I want to say like 40% of patients that I'll see are already taking some type of opioid prescription pain medication. So that translates into, more of that out in the community. Now the government is really cracking down and saying doctors can't prescribe these anymore. Well, what happens when the doctors don't prescribe them? They go and find somewhere else to get that medication. And what the medication is, it's heroin, it's fentanyl. So I can't say that I'm surprised that it doubled, but I'm not sure how to pinpoint why it doubled in this specific year though.
I mean, these are teens, these are kids. A lot of the problem does lie within adults, but with regards to this specifically, that's pretty concerning.
But again, what the kids do they follow the adults, It may not be the 55-year-old adult, but it may be the 22-year-old adult. And as all that trickles down, as we are more complacent and okay with, giving pain medication, and really, I honestly think it comes down to, we as a society we want the quick fix, right? And we want that pain to go away. We don't want to feel any pain. We want our doctor to fix whatever problem we have with a pill instead of, a lot of our problems are lifestyle induced, whether it's hypertension or diabetes. Most of those things are lifestyle induced, not all of them, but most of them. And so this is the same kind of thing. We just get into this, a sense that we need everything to be fixed, and I don't want to take the hard road, right? I don't want to take the hard road or make the hard decisions by exercising every day and eating, good food. I'd rather, not exercise and eat hamburgers and drink soda. That's the easier way. And so I think that is just trickling down to this epidemic as well. They're the same issues. It starts with, it starts up here, not really so much anything specific in maybe our community, but how we think of ourselves and what we're told we should be tolerating and not tolerating.
I've covered fentanyl in Ohio since back in 2015, but that Washington Post study was so staggering that I wanted to know more about how we went from a small group of the population using fentanyl to this. Dr. Parker explained a little bit more about how this health crisis crosses all demographical boundaries.
So it goes back to the opioid prescription problem. So when those kids or patients or whoever it is is not able to get those prescriptions from the doctor anymore because we're starting to crack down, then they move into heroin and fentanyl. And fentanyl just happens to be, the Chinese are shipping a lot of fentanyl into the States now. And I think that's just, another drug that they, not specifically the Chinese, but the drug dealers are trying to push on people. And, if it's available and you can't get your prescription anymore, then you're going to go to the easiest source, which is, a drug dealer or, however you can find that opioid. It doesn't matter if it's in a pill form or an injection. Fentanyl is actually now in a pill form, just like the oxycodone or OxyContin and things like that. And so that's maybe sometimes a little bit easier for people to stomach, like, oh, I'm taking a pill, it's okay, as opposed to I'm injecting. And, the fentanyl is a little bit, it's also been mixed with heroin, which is, more lethal. The fentanyl itself is very strong in intensity. So we're getting a flood of like a new drug in this pill form, and then it's being mixed. And then they're not able to get the prescriptions anymore. I mentioned, my 87-year-old patient who's taking, doses of OxyContin that would kill both of us, twice a day. But, not necessarily her, because she's not able to go out and, find illegal, heroin or fentanyl. But certainly, 55-year-old, white female, she has access to all that stuff. And the addiction is so strong that it drives people to do whatever they can to find it.